EMS was dispatched for a 65-year-old male complaining of chest pains and shortness of breath. EMS arrives on scene. Patient is having problems breathing. The first thing we need to do is maintain this patient's airway, assist this patient's ventilation. So let's give him some oxygen, start bagging this patient. This patient is already showing signs and symptoms, serious signs and symptoms. Let's go ahead and get him hooked up to our monitor, get a blood pressure, pulse ox, let's get our heart rate. Let's get an IV on this patient. 18 or bigger would be nice. Let's check his glucose. Let's do a 12 lead on this patient. Let's check for serious signs and symptoms of shock. We already know that this patient is having problems breathing. Hypotension, altered mental status, signs and symptoms of shock, chest pain, and acute heart failure are serious signs and symptoms of shock. This patient has a low heart rate and altered mental status. We're going to get this patient some atropine, 0.5 milligrams up to a max dose of 3 milligrams. That does not help our patient. Our patient needs pace. So our patient is alert. We're going to give our patient some Versed to sedate the patient, or try to. We're going to go ahead and pace our patient. If that does not work and our patient's vitals are still low, we're going to give our patient some dopamine. We're going to give them 2 to 20 micrograms per kilogram per minute. If that does not work, we're going to give our patient an epi drip. We're going to give them 2 to 10 micrograms per minute. We're going to maintain our vitals, hopefully. We're going to transport our patient to the nearest cardiac center, and we're going to call med base and let them know.